is I'm very concerned that another carcinoid patient will read about this and hear about this, and they won't get to a surgeon of the talent that Dr. Botha has, nor will they have the support that the Nebraska Medical Center gave Dr. Botha. So for those reasons, it was an easy decision for me and an easy to be public, but carcinoid patients, if you're going to try this, make sure you're at a liver transplant center where there's septologists and anesthesiologists, specialized nursing care that deals with liver issues and complications all the time. These are not small surgeries.
I think that's so important to highlight, Ruth, and I'm so grateful to you for going public with your story. It's amazing that a carcinoid patient was the first one to have this procedure done in the United States, and I'm so grateful to Dr. Botha for doing that for you. It's amazing. And I think it's very important, just as the doctors each have highlighted, your general surgeon, Dr. Fitzke, your primary care practitioner, Dr. Zaruba, and your hepatobiliary surgeon, Dr. Botha, each has stressed the importance of collaboration and the need to work with each other very closely, as well as with you, and to be at a multidisciplinary center like Nebraska Medical Center, just as you're highlighting, because it's important to have access to the specialist and to a high quality of care.
Yeah, I think that it is critical as we start this new generation of care in carcinoid that we don't just say, just get to a carcinoid expert. I think if you're going to try this stage surgery, you better be at a liver transplant center with a surgeon who's got all of the support, and then have the primary care physician who's looking after your overall health. I am amazed. These three gentlemen have to be three of the busiest doctors anywhere in the state of Nebraska and in the Midwest. They're the easiest people to find in the world. They're very gracious with their time. They're very generous with their time. Dr. Zaruba, since my case, has now, I think he treats 6 or 7 other carcinoid patients. We have people driving from Oklahoma, from Kansas City to our small town just to get that care. And I think it's a testament to the fact that those three doctors work so well together.
And as well as to the fact that it highlights the need that carcinoid patients have to find a doctor who wants to treat them and who wants to learn more about carcinoid and related neuroendocrine tumors, and to find a center that is willing to have doctors practice with these patients and focus on them.
Oh, absolutely, and to be able to trust them. You know, we did take a leap of faith to do these surgeries, but it was very measured, it was very researched, and it was very detailed. And, you know, as busy as these three doctors are, they never made me feel rushed. If I came in, which I did, with, you know, 10 pages of questions, Dr. Botha and I sat down with my husband and we answered all of them. And then I'd go back and more questions had come up and I'd see Zaruba, and then the two of them would talk. And we did that about a half a dozen times before we finally proceeded with the surgeries.
Well, I think that's such an important point for carcinoid patients to know, that you really need to sit down with the doctor, the surgeon, whoever's going to treat you, and ask a lot of questions and make sure that they feel like, the patient needs to make sure that the doctor feels that it's as important for him or her as it is for the patient. And I think that's what your doctors were also highlighting as well, saying that, you know, it has to be, it's an important day for the surgeon and it's an incredibly important day in the patient's life, in your life and in my life, if when we go in for treatment.
Absolutely, and I think because of the atmosphere here at the Nebraska Medical Center of innovation with the liver transplant program being such a premier program, as well as their bowel transplant program, I think there's a culture here of openness and working with anybody who can give them good thoughts or any idea that can be brought forward. I actually got to Dr. Botha because of a third-year medical student at UNMC that's a family member. He kept telling me about this wonderfully talented surgeon in the OR, but what a great person he was besides that. And that combination, when Dr. Fitzke told me I couldn't get into the liver, Ruth, it was beyond my capacity, the first thing he said to me was, you really need to get to one of the liver transplant doctors at the medical center. And having heard my nephew talk about this wonderful transplant surgeon, it became a very easy place for me to look to for help. And then with the collaboration and the ease of getting a hold of everybody and all of that made it very seamless for me. The other thing that Nancy, I think is really important for patients dealing with carcinoid that I have learned is not the norm, but certainly was the norm in my case, is what the Nebraska Medical Center, what Dr. Fitzke's office and Dr. Zaruba's office did for me in regard to my insurance. I did not have to lift a finger to get any of this approved by my insurance. They did all of the work.
That's an incredibly important point, Ruth. And is that normal? Have you found that?
I'm finding from other carcinoid patients that is not the norm.
Is it normal here in Nebraska?
It is very normal here in Nebraska. And I think, again, it comes from having a liver transplant. They're used to working with patients from all over the U.S. as well as all over the world. What I found as we were going through getting my insurance approved is they have access and readily available every piece of documentation they would ever need for a piece of liver surgery.
I see.
And so because the insurance people know that and it's readily available, it makes it much easier for the patient.
Oh, terrific. That's very important to underscore because insurance is such a tricky issue.
Yes.
Especially with a new procedure and especially on a carcinoid patient.
Yes.
Well, it's a wonderful story, Ruth. Thank you so much for sharing it. I'm very grateful to you, and I know many patients will want to contact you. Again, we're here at the Nebraska Medical Center, and for more information, if you have any questions, please contact us at the Caring for Carcinoid Foundation, or please contact the Nebraska Medical Center. Thanks very much.